Do you have vertigo? You ever wonder what vertigo is? Or you probably know people who have vertigo. Vertigo basically is dizziness. Remember when we were kids, we'd sit in a chair and we'd have someone spin us around, and then when we'd start spinning, we'd get up and we could barely walk, we'd lose our balance, we felt like the ground is moving, the room is spinning. That's vertigo. There's a part of your brain in the back called the cerebellum that manages your balance. A lot of times, if it's in the brain, brainstem, and cerebellar issues, that can cause vertigo. But vertigo really can be simple too. There's this thing called benign positional vertigo, which basically means the position of your head, it causes that dizziness feeling. That could be because there's issue inside the ear. We have these ossicles, little hammers that move around. There's fluid in the semicircular canals, and those fluids, when they don't move properly, they can cause vertigo, and that can be corrected by a technique called Epley's maneuver. And it's basically something that chiropractors and physical therapists can do, where they put your head back in a position where you're lying down. First, they'll figure out which side they need to be on. They'll turn your head, they'll turn your body, hold in a position for 30 to 90 seconds, and then it corrects itself. There's lots of videos on Epley's maneuver if you're interested in that. But there's other types of vertigo. Believe it or not, viral infections on the acoustic nerve can cause vertigo. The vestibulocochlear nerve, which is one of your cranial nerves, a viral infection there can cause vertigo. Also, there's diseases like Meniere's disease. Meniere's disease is accompanied by ringing in the ears or tinnitus, hearing loss, and vertigo, and it can be pretty severe. You'll have attacks. People who have that are usually told not to eat salt. I don't know if that's accurate. I haven't seen reducing salt really help, but it's been recommended. Another one, it can actually have to do with your neck vertebrae. See, if the vertebrae in your neck tell the brain where the ground is, and when you turn your head to one side or the other, the brain knows, because there's communication from those bones to the brain. It says, oh, my head is turned this way or that way. Well, sometimes a bone in the neck, especially upper neck, could be turned to the right. So even though you're headed straight, that bone is turned to the right. So that bone keeps telling your head, well, your head's turned to the right. And your eyes are telling your brain, they're not. My head is straight, and you're getting mixed signals, and that can cause vertigo. Sometimes if vertigo is bad, you'll see the eyes go back and forth. If you ever put a child in a seat and turn them, spin them, and stop, you'll see their eyes keep darting back and forth. That's called nystagmus. If it's from the neck, quite often that person will say, hey, when I look straight, I'm dizzy. When I turn my head, for example, this way, I get more dizzy. When I bring my head to this side, I'm not dizzy. Well, that probably means there's a bone that's rotated to the left, and if a chiropractor adjusts that bone back to center so that when the person is looking straight, that bone is also facing straight, that vertigo goes away. That's called cervicogenic vertigo. That's what chiropractors are amazing at, and so we've seen lots of patients. I got a patient probably last week or the week before, came in massive vertigo, and I had her do a bunch of tests. I had her look down, vertigo got worse. Brought her head back to center. It was still there, but a little bit less. When she looked up, there was less vertigo. So that means the bone is probably tilted up too high or tilted down, and when we bring the head up, the vertigo becomes less. So the way I adjusted was to tilt that bone so it's up. So when they're looking straight, the bone tilts up, and that took pressure off the brainstem, spinal cord, and started sending signals to the brain that you're balanced. There's so many causes for vertigo, but if you're having vertigo, don't ignore it. Obviously, it feels like motion sickness. Motion sickness medicine, over-the-counter meds sometimes help temporarily. If it's not helping you permanently, find a good chiropractor. Let's get your neck looked at and find out what's going on. I hope all that information helps you. If it does, please share the video. Send it to people you know who may be battling dizziness, vertigo. By the way, lightheadedness is very different than vertigo. We'll do a video on that next. Subscribe, like the video, share it, and let us know what you think in the comments. We'll talk again soon.